impacted this wax really deep in the ear through the use of Q-tips, or what we call in the UK cotton buds, and all they managed to do was just embed and push this wax right up against the eardrum. They've since been using some hydrogen peroxide drops as well. Hydrogen peroxide drops can make the wax a bit sticky, and I'm just using microsuction to, in the left ear, we're starting off with the left ear, and I've approached the plug of wax against the eardrum, loosened it off the base of the ear canal, so it retracted it off the ear canal walls to mobilize it before slowly coming out. Nice and healthy eardrum. So the wax was a bit sticky and mushy, so there is some residual sticky wax coating the canal wall. It's not significant because it is sticky. It's sometimes a bit difficult to remove. So I'm just hovering over it with the fine end suction probe here, and if it comes off, that's all great. If not, it's not a problem. It's not going to affect the patient. And there we've got a good view of the patient's eardrum, so it's intact. We've got a light reflex present. This is the patient's right ear. They were surprised to learn that they actually have got wax in this ear, so they weren't experiencing any symptoms. But as soon as I removed the wax from their left ear, which is their worst ear, they suddenly noticed the right ear was blocked. So, of course, the left ear was worse for the patient. Therefore, there was a reference point. Well, the reference point was their right ear, which they believed to be normal. And once I removed the wax from the left ear, the reference point then became their left ear, and they noticed that the right ear wasn't as good. This one, I would say, there's a larger plug of wax, but it wasn't up against the eardrum, although it was quite medial, so deep in the ear. It wasn't stuck to the eardrum like the left side. There was also a slight opening at the top of the ear canal, the roof of the plug of wax, which allowed some sound to enter the ear. And the patient had also been using drops on this ear just as a preventative measure. You can see around the edge at the base of the ear canal where the drops is seeping out of the inferior recess. So beyond the plug of wax, we've got the inferior recess. There's some drops that got stuck there, and as I was moving the plug of wax, the drops was coming out. So it's coating the canal wall and the plug of wax. Now with this patient, you can see the eardrum, it's not as healthy as the patient's left eardrum. There is what we call an attic retraction. So if you look at the top of the eardrum, on top of the hammer bone, there's a retraction. The eardrum's sucked inward and it's created a pocket, and we call that a retraction pocket. And that's due to eustachian tube dysfunction. The patient's eustachian tube, which is a narrow orifice which connects the middle ear, so the cavity behind the eardrum, to the back of the nose. It's blocked at the back of the nose, which has created a vacuum effect, so there's no air behind the eardrum, so the eardrum's got sucked in. And typically, in most cases, it's the top part of the eardrum that gets sucked in, because the top part of the eardrum, what we call the pars flaccida, is it's a lot more flaccid. It's not as tough and rigid as the main body of the eardrum, so it gets sucked in, and that creates a pocket. So we diagnosed that with a pressure test called tympanometry, which not only assesses the mobility of the eardrum, but it also evaluates the air pressure behind the eardrum. The patient has got a bit of a sniffly nose, so it's probably likely to resolve by itself, but we're just recommending some nasal decongestion sprays to unblock the eustachian tube, because the eustachian tube typically gets blocked at the back of the nose, the nasopharynx. Once it's unblocked, air can travel up the eustachian tube to pop the eardrum back out. So what this patient's experiencing is very similar to what most people experience on the aeroplane when they descend. The air pressure pushes the eardrum inwards, and we close our mouth, pinch your nose and blow, and we can force air up the nose, up the eustachian tube, and it just pops the eardrum back out. So this is the plug from the patient's, I believe, the first ear, the left ear. This is the one from the right ear. You can see the close-up shot there. There's a bit of dead skin around there. And they're both